BDD and suicide is a critically important topic, I think, because not only is suicide attempts, thoughts, completions extremely common in people with BDD, it's probably actually more common than in any other mental disorder. And for that reason, it's certainly important for not only people with BDD, but their families or others involved with them, as well as professionals working with them, to recognize that professionals certainly need to inquire about suicidal ideation and a history of suicide attempts, things like that, and treat it aggressively. The treatments for BDD that are well established are both cognitive behavioral therapy and medication, and both are appropriate in interventions with people with suicidal ideation or suicide attempts. One of the things that we find, a lot of people with BDD actually don't head for mental health treatment. They instead head for treatment with dermatologists, plastic surgeons, and so forth. And interestingly enough, that actually may increase some of their risk for suicide, because they go ahead and get plastic surgery or exhaust dermatological treatments and so forth, and are not satisfied with the results and end up very hopeless. And hopelessness is a predictor for suicidality. Yeah, I think we have to be actively inquiring about the suicidal ideation, and sometimes people won't tell you, but and then actively paying attention to things like the hopelessness, events that may increase it, such as, again, some kind of failure in treatment, or some kind of, a lot of people, for example, with the plastic surgery thing, will say, if I could just get this done, then everything will be wonderful. And they get it done and everything's not wonderful. So they're often thinking in very black and white terms. If it's not wonderful, it's terrible. So we need to, again, the clinicians particularly, but family and even the people with BDD themselves need to be aware that this is going to be an issue. This is going to be something they're going to think about. And sometimes people can kind of confuse, if I think about something, that means I'm going to do it. That's not necessarily true, certainly, but it's something to pay attention to.